Now let's proceed to our third drug, darolutamide with the brand name Nubeqa. Darolutamide falls under the category of androgen receptor inhibitor, so it inhibits the binding of androgen to its receptor. Darolutamide is indicated for the treatment of patients with non-metastatic castration-resistant prostate cancer or the NMCRPC. The mechanism of action of our drug, just like what I have said, it is an androgen receptor inhibitor. Darolutamide competitively inhibits the androgen binding to its receptor. Also, the androgen receptor nuclear translocation, and another is androgen receptor mediated transcription. So basically, the drug inhibits three processes. A major metabolite, the ketodarolutamide, exhibited similar in vitro activity to darolutamide. In addition, darolutamide functioned as a progesterone receptor antagonist in vitro, approximately 1% activity compared to androgen receptor. Darolutamide decreased prostate cancer cell proliferation in vitro and tumor volume in mouse xenograft models of prostate cancer. Our drug is available as a 300 milligram tablet. So the characteristic is white to off-white oval film-coated tablets marked with 300 on one side and Bayer on the other side, since the maker of the drug is the Bayer company. The recommended dose of Nubeqa is 600 milligram, two 300 milligram film-coated tablets taken orally twice daily. So this is equivalent to a total daily dose of 1.2 grams or 1,200 milligrams. You need to swallow the tablets whole. Do not crush the tablet, do not break the tablet, and swallow it whole with food. So what's unique with this drug? Darolutamide is a structurally distinct androgen receptor inhibitor with low blood-brain barrier penetration and low potential for drug-drug interaction. Now, being said that it has a low blood-brain barrier penetration, the drug is good to be given to patient, so we can't expect any mental effect to the patient. And since this is a chemo drug, we can expect that a lesser side effect will be experienced by the patient because of that low blood-brain barrier penetration. Darolutamide is a next-generation androgen receptor antagonist with a distinct molecular structure compared to enzalutamide and apalutamide. These are the other drugs previously approved and also are androgen receptor inhibitors. And preclinical data suggests that darolutamide is a more potent androgen receptor inhibitor, negligible blood-brain barrier penetration, and no activation of the androgen receptor mutations such as the AR-F877L. Moreover, phase 2 and 3 data demonstrate high anti-tumor activity and a very safe toxicity profile, similar to placebo in the ARAMIS study. So in conclusion, darolutamide has shown low blood-brain barrier penetration, and this may be associated with preclinical and clinical data that show low pro-convulsive potential. Darolutamide was associated with a greater benefit in all secondary and exploratory ARAMIS endpoints versus placebo. From a safety perspective, the overall incidence of adverse events is low, and darolutamide appears to be relatively well tolerated. Darolutamide demonstrated a significant improvement in metastasis-free survival in patients with castrate-resistant non-metastatic prostate cancer with a prostate surface antigen doubling time of less than or equal to 10 months and PSA levels more than or greater than 2 nanogram per ml. So if you want to continue reading about the studies regarding darolutamide, you can visit these websites. And also, if you want to know about the Aramis study that was presented before the previous slides, you can look for these journals, and you can read all of the results of the clinical trials done using the drug.